I just love what I do. You know, I love that feeling of taking care of people, trying to figure out the best thing for them to get them where they want to be. My father was a chemistry professor. My mother was just a wonderful human being and humanist. So I grew up in Pasadena and went to school in the Bay Area and really enjoyed mountains and rivers growing up. And when I was working as a river guide, I met physicians and they talked about what they did and why they liked it. And that sounded appealing, and it was a good combination then of science and people. So it's been wonderful. We started off as a Vancouver orthopedic group, and so there were 5 of us, and then I joined. So I was the 6th, and now we have 20 orthopedic surgeons, and neurosurgeons and physiatrists, and PAs. It keeps getting bigger and bigger. When I joined, we all stayed late and worked. You know, it'd be unusual to get home before 9, and we didn't really have specialties. So if somebody had a back problem, somebody had a hand problem, a foot problem, a pediatric problem, a joint replacement problem, each of us would take care of those patients. So there was one day, one meeting, one night when we all decided that we were going to separate off our specialties. And because we kind of had specialties, you know, I'd done a fellowship in sports medicine and trained at a hospital where there was doing a lot of joint replacements. And it's absolutely true. The more you see of something, the better you get at it, the more you realize the subtleties of it. Then I had been asked to be the physician of the Trailblazers, and that was 1994. So I would see him in our office up in Vancouver, but it seemed like a good idea to develop an office in Portland. And so we came up with the name Rebound that could have some Northwest surgical specialists, could have physical therapy, could have different entities working under that same name. And then it just made sense to bring it over the river and make it the name for our whole group. Well, I have a wonderful family, terrific wife. Parenting was really fun, but it happened really fast. And, you know, you tell people that their lives are going to go by really quickly and when they have kids, and people told us that, and it was absolutely true. But and every part of it was great. And I have a daughter who is an orthopedic resident now. And I have a son who's a MD PhD student. So they all sort of see some advantages in medicine. What gives me joy professionally, it is just a privilege to be able to do what I do. I am so lucky to have the job I have, because we get to, we have the tools, we have the techniques to take people who have pain, you know, who have problems with their function, with difficulty walking, and change their lives. And that happens, and every time it happens, it's magic. It's one of the best things we do as a society is to, you know, have the opportunity to cure people's movement problems and get them back on their feet, make them rebound.